Good morning to everyone. I'm Dr. Augustin, Medical Director of St. Luke Foundation, proud partner of FPCD. On behalf of the St. Luke Foundation, a proud partner of FPCD, we salute the members of G7 Plus and the FPCD and are honored to present this short speech on the occasion of this conference, Transitioning from Fragility, Solutions for Reimagining Development. At the level of the St. Luke Foundation, existing since the year 2000, we have so far created and implemented a network of 32 national mixed schools, welcoming more than 12,000 students, an 85-bed hospital with a network of 7 satellite clinics at the country level, serving more than 45,000 beneficiaries annually. Our production center includes, among other things, a workshop for the production of medical oxygen, pasta and bread, cement blocks, and we also produce honey and raise chickens with the production of eggs for consumption. Through our assistance program, we help the most vulnerable communities by providing them with 3,000 gallons of drinking water every day and humanitarian aid in disaster situations, internal refugees due to violence, natural disasters, earthquake, dirt, floods, etc. By directly generating more than 1,600 jobs, the St. Luke Foundation can be proud to reach more than 80,000 annual beneficiaries in a country with more than 65% unemployment, marked by poverty, to the point that according to the UN headquarters centers, more than 4.5 million Haitians are in food insecurity in 2022. Our actions at the community level resonate with the dense development strategy envisaged by FPCD. Indeed, all our initiatives and all our programs, particularly in the field of education and health, bear witness to this transitional model for producing sustainable development. These programs are negotiated with the communities and offered to it as a community goods using the inclusive participation of its members. The Women Health and Training Center in Saint Louis du Sud, developed in partnership with FPCD, is a perfect example. Targeting the community of Saint Louis du Sud, estimated at around 70,000 inhabitants, spread over 185 square kilometers. It is located at more than 150 kilometers from Port-au-Prince, the capital of Haiti. I also remember a 3 hours drive with the FPCD delegation in September 2016 for the symbolic handing over of the keys of the building hosting the clinic. Saint Louis du Sud, being a very small town with a density of 350 inhabitants per square kilometer, compared to Lisbon, which is the density is 5,000 inhabitants per square kilometers, or Monaco with 19,000 inhabitants per square kilometer. Nearly 84% of the population is rural at Saint Louis du Sud. Through the strategy of navigating development through diplomacy and negotiation with the community, through an inclusive process, the center was developed at the same level as the site of the St. Paul Foundation Mixed Schools of St. Luke, already also housing a community bakery. The project was discussed with the community leaders, town hall, judge, and religious leaders and accepted. Therefore, the Women's Self-Training Center respond to the needs expressed by the population by offering health coverage alongside the instruction delivered by the St. Luke Foundation through the mixed schools of St. Paul with 297 students from the community. On an inclusive basis, the center employs 3 nurses and a doctor, all from St. Louis du Sud or the surrounding area, to strengthen the feeling of ownership of the center by the community. Operational from February 2017, the Women's Health and Training Center in Saint Louis du Sud was the 5th dispensary available for the municipality, which had not so far registered any initiative from the Ministry of Public Health and the population. From this facility of the time, after about 5 years of operation, the population now has a safe address and a reference in terms of preventive and curative care. Thus, more than 13,000 consultations have been carried out to date, with 42% of adults against 56% of children, and pregnant women represent around 1% of all these consultations. The center welcomes mostly women, about 65% of the consultations, and is served by an all-female staff who also welcomes and educates patients on the themes of preventive health. The center, as a community asset, play a key role in the health education of the community during the COVID pandemic in Haiti for the past 2 years by being a point of distribution of clothing for hand washing and face masks. During the August 14th, 2021 earthquake, the clinic was also a focal point for the organization and deployment of post-earthquake medical assistance to the communities of St. Louis du Sud. Following this earthquake on August 14th, 2021, more than 500 victims have been able to receive medical assistance. Still on this momentum of inclusive and participative community participation, the center is about to extend its service to the population by soon offering a medical analysis laboratory. The Women's Health Clinic, developed in St. Louis du Sud by FPCD in collaboration with St. Luke Foundation, is a true example of the dense strategic development proposing by FPCD, transitioning from fragility, proposing solution for development. Thank you all for listening.